Imagine going to your doctor for help only to be told it's all in your head or you're just stressed. This is not only frustrating but can also delay proper diagnosis and treatment. Hello and welcome to the Crowned Crane YouTube channel, where I, your digital nurse coach, will be sharing everything chronic illness. And as a nurse, a registered nurse, and also a chronic illness patient, I believe I have a lot to share. So today we'll be talking about the struggles of living with an invisible disease or an invisible disability. An invisible disease is a medical condition that doesn't have obvious physical symptoms. This means that a person with an invisible disease might look perfectly healthy on the outside, but they can be experiencing significant pain, fatigue, or other debilitating symptoms internally. Invisible diseases can include a wide range of conditions, chronic illnesses like fibromyalgia, chronic fatigue syndrome, and diseases that cause persistent pain and exhaustion. Also, under this category, we have autoimmune disorders like lupus, rheumatoid arthritis, psoriatic arthritis, and multiple sclerosis. There's a long list. This is where the body's immune system attacks its own tissues. We have mental health conditions like depression, anxiety, which impact a person's emotional and psychological well-being. We also have neurological disorders like epilepsy, which affect the nervous system and brain function. One of the main challenges of living with an invisible disease is that the lack of visible symptoms often leads to misunderstanding and skepticism from others. People with these conditions might hear comments like, "But you don't look sick," or "Don't you think it might just be in your head? Maybe it's anxiety." "Oh, you're too good looking to be sick like that. You're too young to be sick like that. Why are you using a cane today, but you were not using a cane yesterday?" These comments can be very invalidating and they hurt. Despite their invisibility, these diseases are very real and can have a profound impact on a person's life. It's important for us to educate ourselves, offer support, and advocate for better awareness and understanding of invisible diseases. If you feel like you may have an invisible disease, first consult with healthcare providers. This includes your primary care doctor, who will refer you to specialists like rheumatologists, neurologists, and mental health professionals. They can offer medical advice, prescribe treatments, and refer you to other resources, hopefully. Don't hesitate to ask questions and advocate for your needs. If you feel your concerns are not being addressed, seek a second opinion. Now, let's talk about medical gaslighting. Medical gaslighting occurs when healthcare providers dismiss, minimize, or deny a patient's symptoms, suggesting that they are made up, exaggerated, or imagined. Imagine going to your doctor for help only to be told it's all in your head or you're just stressed. This is not only frustrating but can also delay proper diagnosis and treatment. Gaslighting can happen to anyone, but studies show it's more common amongst women, minorities, and those with invisible diseases. Being gaslighted by medical professionals can make patients doubt their own experiences and feel isolated. It can also lead to worsening symptoms and mental health issues. So, how can you advocate for yourself if you feel you're being gaslighted? Become familiar with your rights as a patient and the medical facility policy on a patient-doctor relationship. If you feel violated, report the interaction or fire your doctor. When I say fire your doctor, find a new doctor. Here are some strategies to help you navigate these situations. 1. Keep a health journal. Document your symptoms, including their frequency, intensity, and triggers. This can help you provide clear and detailed information to your healthcare provider. 2. Seek a second opinion. If you feel dismissed by a doctor, don't hesitate to seek a second opinion. Different doctors have different perspectives and approaches. Three, bring a support person. Having someone with you can provide emotional support and help you remember important details during your appointments, because that brain fog will get you. Educate yourself. Learn about your condition and treatment options. Being informed empowers you to ask better questions and advocate for appropriate care. 5. Be persistent. Don't be afraid to assert yourself if something doesn't feel right. Trust your instincts and keep pushing for answers. 6. Use patient advocacy services. Some hospitals and clinics have patient advocates who can help you navigate the healthcare system and address your concerns. Invisible diseases, medical gaslighting, insensitive comments, and weird judgmental stares from strangers, even family, are significant challenges. But with the right strategies and support, you can advocate for your health and well being. Remember, you know your body best and your experiences are valid. So, I want to talk about support groups. Join support groups, both online and in person. These groups can provide emotional support, practical advice, and a sense of community. Websites like meetup.com, Facebook, and specific organizational websites often have listings for support groups related to various conditions. You also have online communities. Online forums and social media groups can be valuable resources. Websites like Reddit, Health Unlocked, IG, Facebook, as I said before, and dedicated forums for specific illnesses offer a platform to connect with others who understand what you're going through. You also have nonprofit organizations. Many nonprofit organizations provide resources, information, and support for specific conditions. Examples include the Lupus Foundation of America, the National Fibromyalgia Association, and the Anxiety and Depression Association of America. These organizations often offer educational material, helplines, and patient advocacy. Next resource we have is educational materials. Access educational materials such as books, articles, brochures, and videos to better understand your condition. Knowledge is power, and understanding your illness can help you manage it even more effectively. We also have to look on the financial toll that these illnesses take on us. Look into financial assistance programs such as nonprofit organizations who offer grants or financial aid for medical treatments, medications, and other expenses. Additionally, government programs like Social Security Disability Insurance can provide financial support if you qualify. You also have legal resources. We also have to look at legal resources. If you feel you have faced discrimination at work, at school, or just your healthcare interaction with your providers, there are legal resources that can help. You have organizations like the Equal Employment Opportunity Commission, EEOC, here in the US. They provide information and assistance regarding your rights. We cannot forget to mention that we need the mental health support. Chronic illnesses are tough. Living with an invisible illness can be emotionally taxing. Seek therapy or counseling to help cope with stress, anxiety, and depression. Many therapists specialize in chronic illness. We also have self-care strategies. Implement self-care strategies such as regular exercise, a balanced diet, adequate sleep, and mindfulness practices. These can help improve your overall well-being and manage symptoms. A big deal is advocacy and awareness. Get involved in advocacy and awareness efforts. By raising awareness about invisible illnesses, you can help reduce stigma and increase understanding and support from the broader community. And also, it helps you to better explain your disability to others. Living with an invisible disease is challenging, but you don't have to do it alone. Reach out, connect with others, and utilize the resources available to you. Together, we can create a supportive and understanding community. Hence why I started this YouTube community, because I wanted to be a part of starting that community here online. When you get ready to talk about your invisible disease to your loved ones or the people who you need as a support for you, choose the right time and place. Find a quiet, comfortable setting where you can have an uninterrupted conversation. It's important to have their full attention and to have a quiet environment during this time. Be honest and clear. Use clear and simple language to describe your condition. You might say, I have a condition called fibromyalgia, which causes chronic pain and fatigue. Even though I may look fine, I'm often in a lot of discomfort. Use analogies and visual aids. Analogies can help make complex medical conditions more understandable. For example, you might say, imagine having a flu that never goes away to describe chronic fatigue. You can also use diagrams, charts, or written information to help explain your condition. Share your personal experience. Describe specific ways your condition affects your daily life. Sharing personal stories can help your loved ones understand the impact on you. For example, I often have to cancel plans last minute because my pain becomes unbearable. When you're ready, encourage questions and open dialogue. Invite your loved ones to ask questions and express their feelings. This can help clear up any misunderstandings and foster a supportive environment for you. You can also provide resources. Share articles, books, or websites that offer reliable information about your condition. This can help your loved ones learn more and understand what you are going through. Discuss your needs. Explain what kind of support you need. You might say something like, I need extra rest, and it would help if you could be understanding if I need to cancel plans, or it would mean a lot if you could accompany me to a doctor's appointment. Be patient and give time. Remember that it may take time for your loved ones to fully understand your condition. Be patient and allow them to process the information at their own pace. Next, we have highlight the importance of support. Emphasize how their support can make a significant difference in your life. Let them know that their understanding and patience are incredibly valuable to you. Living with an invisible disease can be difficult, but effective communication can help build understanding and support from your loved ones and partners. By being honest, patient, and clear, you can foster a supportive community and empathetic environment. If you enjoyed this video or got any value from it, please like, share your invisible disability story in the comments, and I'm sure a video will pop up here. Check it out. I believe it has some information that might be helpful for you. See you.